Well, Angelina Jolie reveals she is now in full-blown menopause. The 39-year-old actress had her ovaries removed last week and is now undergoing hormone replacement therapy. This comes 2 years after Angelina had a double mastectomy after a blood test raised fears that she may be in the early stages of breast cancer. The actress says she has a genetic mutation that gave her an 87% risk of breast cancer and a 50% chance of ovarian cancer.
Well, our guest this morning is Dr. Angela DeRosa, and she's an expert on women's hormonal health. And we're glad you came in. And you were telling us just a moment ago, you have some experience of your own in that regard. Tell us about that.
Yes, when I was 35, I actually went through full-blown menopause. I was one of those 1% of women that had premature ovarian failure, not from taking my ovaries out like Angelina Jolie did, but so I know what she's going through. And it's sometimes we laugh and joke about menopause, but it's no laughing matter. It has actually serious health consequences, and it makes us feel like we're going crazy. I know I'm a little crazy, but not that much.
So she made these plans to have this surgery done after she's had been in the news, 2 years ago with the high chance of having breast cancer after she told everyone that she had this gene that makes her predisposed to having cancer. Is this a common treatment for something like this as a way to hopefully lower your risk of getting it?
Well, every woman should make an individualized choice, so we're not advocating that surgery is the answer for everybody. But when you have an 87% increased risk of breast cancer and a 50% increased risk for ovarian cancer, I'm walking into a casino looking at those odds. I'm not liking those. So certainly taking those risks away is prudent for most women. The problem with that is when you remove the ovaries, instantaneously these women go into menopause, which it's not a gradual thing that happens to us over time. This is a sudden drop, and they go into a full-blown menopause, which not only you start getting the hot flashes, the night sweats, which we commonly think of, but women also make testosterone, which leads to glucose problems, weight gain, especially in the midsection, low libido, mood changes because it affects our serotonin.
And is that why now she's having to do the hormone replacement therapy?
Well, she actually went and talked to both Eastern and Western medicine doctors, which I think is great because there's ways to derive from both. But unfortunately, in conventional thinking, we've kind of disregarded hormone therapy and said it's bad for you. But actually, the research doesn't suggest that, and it's been largely overplayed, the risks in the media. So the good news is there are good options, but you need to know what you're doing. Is it bioidentical? Is it safely being provided by someone who knows and understands hormone therapies? She has chosen to go the hormone therapy route, which is really, she's become a wonderful advocate for hormone therapies. But again, we have to make sure that we're doing it for the right reasons in the right patient population, and also realizing that you're never too young to have hormonal imbalances. We often think of old women.
No,
Here's
you're
this
right.
beautiful, vivacious woman who is just the epitome of beauty, and she's in menopause, and she's choosing an alternative route for herself at that age. Which is wonderful.
We just have a couple of seconds left, but this is an area of specialization, right?
It should be.
So if this is something you're concerned about, maybe this is perhaps beyond your general practitioner. You want to get to someone who can really dial in your needs.
Unfortunately, a lot of physicians have the basic understanding that the general lay population does, that hormones are bad for you, but really there's great data and research to suggest otherwise. Really, you should be honing in on hormonal specialists who have researched and understand this area of medicine, because your straight-up gynecologist, internist, primary care are not going to understand it.
Really quick, we have to wrap, but risks would be what with hormonal replacement therapy?
Certainly active breast cancer, active reproductive cancer, so uterine, ovarian. If you're 80+ years old and not seeing hormone therapies in your body for a long period of time, that may be questionable, but certainly you need to weigh the risk and benefit of each individual
And you need to have this conversation with a healthcare professional.
Absolutely.
Somebody that specialized in that. And you have locations all across the valley.
Yes, we have 5 locations at DeRosa Medical, in Scottsdale, Chandler, Gilbert, Sedona, you name it, we're everywhere.
Okay. Yeah, I mean, if anything, Angelina's putting it out there, at least for all of us to start kind of taking ownership in our own health. Especially, as a woman, we need to do that for sure. And men, for that matter. Thank you so much, Doctor.
Thank you.
Nice to meet you.
Yeah, we'll have you back for sure.